one of the age-old questions in prostate cancer for men whose cancer has recurred is, when should we start hormonal therapy? So we sought to address this in looking at a large group of men who all had radical prostatectomy, who then developed a PSA recurrence. Basically, one of the issues, and statistically in dealing with this, is all men are going to get hormonal therapy before they eventually progress and die. So you can't just look at did they get hormones. So we really tried to look at the timing. So we called early hormonal therapy as a PSA below 5, getting hormones when their PSA is below 5. And so we matched each patient to 10 closest patients who had a similar PSA at that point in time, but weren't on hormones. So kind of a matched case control. And ultimately left us with 489 men. And what we found is this early use of hormonal therapy really had no benefit to the patients. And if anything, the patients actually seemed to do worse. And so we said, well, maybe there's high-risk patients, low risk, let's look at this. And we did see, for example, for men with a doubling time less than 9 months, that the hormonal therapy, early hormonal therapy, did seem to suggest benefit, whereas if your doubling time is greater than 9 months, it actually suggested harm. In younger men, it actually suggested harm. Benefit in older men, which may be a marker that we're just treating healthier men, whereas older men were less worried. We didn't have comorbidity data to adjust for. And then we looked at high risk, Gleason 8, seminal vesicle invasion, node positive, absolutely no benefit, whereas low risk, it actually was harmed. So I think in summary, it's not a randomized trial. There's lots of limitations. We need to gather the comorbidity data to adjust for. But we're not seeing a great benefit to early hormonal therapy. And actually in a lot of subsets there was harm. Maybe in the short doubling time there may be some benefits, but we really need to tease that out more.